Good morning, everyone. I'm going to start our public health media briefing for September 16th. You'll hear an update from Dr. Kasirier, Sacramento County Public Health Officer, and then from Rachel Allen, who is giving an update on vaccinations. After that, we will open it up for the media to ask questions. As always, please raise your hand. I will call on you. As a reminder, this is the only media availability for public health staff today. So if you have questions, I suggest you ask them now. With that, I will turn it over to Dr. Kasirier.
Good morning, everyone, and thank you for joining us. So a brief update on the numbers. We have 144,218 cases of COVID-19 reported to Sacramento County. This is as of yesterday morning. We are averaging about 420 to 450 cases per day. So we are seeing a decline in the number of cases per day. And the case rate is also 27.1 per 100,000. So there is a decline in the case rate as well. The deaths are 2,052. We are still seeing an increase in the number of deaths reported, an average of about 7 to 8 daily. So with that, I'll turn it over to Rachel to talk about immunizations.
Hi, good morning. I'll just speak to our plans for COVID vaccine clinics as well as flu clinics over the next few months. So this is, the time of year that our focus would normally shift to our community flu vaccine clinics. Historically, we do plan clinics and try to reach as much of the county as we can geographically, but really focusing on underserved areas and areas that have been impacted by flu. But of course, we acknowledge that our work with COVID vaccine isn't done, and we still need to prioritize COVID clinics as well. And so we are going to transition to a dual vaccine strategy beginning October 1st. The CDC did announce earlier this year it's safe to co-administer COVID vaccine with other vaccines. So with that in mind, that is the strategy we're going to adopt. And so we'll be offering COVID vaccine at our flu clinics and also taking flu vaccine to our COVID clinics. So really trying to combine the two over the next few months. We release a flu schedule. It should be coming out hopefully in the next few days. And so our flu clinics are always walk up. There's no appointments needed for those. But if someone does come to a flu clinic and wants to obtain a COVID vaccine, it should be possible for them. And then we'll still continue our community pop-ups. We do have some changes in resources coming, so that will be shifting a little bit, but we're going to continue to offer those. And you can schedule appointments still through My Turn. We do take walk-ups at those appointments too. I'm sorry, at those clinics as well. So the goal would be that if someone does come to a clinic and they are there for COVID, but realize they need to get a flu shot, we could do that, or vice versa. They're there for flu and want to take advantage of a COVID vaccine, they can do that as well. So we will continue to prioritize our COVID pop-ups in communities that have low vaccination rates. And we are also working with the school districts to offer combined flu and COVID clinics on school campuses, really acknowledging that we have good uptake when families have the opportunity to come together. So we typically do those in evenings or on the weekends. And we are looking ahead. We do know that boosters are still a question for the fall, as well as expanded eligibility for 5 to 11-year-olds. We're in close communication with our partners and schools, working on a plan to make sure that we're prepared. And I think what we really want to remind people right now, it's just still really important to get vaccinated. The flu vaccine is typically available in pharmacies now and provider offices, so please don't delay getting a flu shot for any reason. And again, COVID vaccine, it's the same. It is available at most pharmacies and doctors' offices. We would love to see you at our COVID or flu clinics, but if you can obtain those vaccines sooner, please do so. We would just encourage folks not to delay getting vaccinated.
I also, again, wanted to emphasize, because a large part of our response during this period has been with the pop-up clinics, especially in the underserved communities. But now with the transition, and also with several of our resources that are not going to be available after September, which is curative and the National Guard, we are not going to have the same capacity for pop-up clinics. We will try as much as possible to meet the requests that we get, but we will have reduced capacity for those pop-up clinics. So a huge focus come October for us will be the vaccination clinics that we will have for the flu and for COVID. We do want to remind folks that there are a lot of other places that people can get vaccine right now, which includes the pharmacies as well as healthcare providers.
That concludes the update from staff. I'll open it up now to questions from the media. If you have a question, please raise your hand. Lena, go ahead.
Good morning, Dr. Kasirier. I just had a quick question for you. Earlier this week, we saw the Board of Supervisors vote on a misinformation resolution where they say that they will only be using sources that are science-based to make their decisions on the county level. So what are your thoughts on this resolution, and how do you believe that this will help you in your role as our public health officer?
The board has been supportive of public health throughout this response, and we do appreciate the support. And we do provide them with information based on the information that we get from the CDC as well as CDPH. And as we make decisions, for example, mandates that we are passing, we do provide that information to them. So definitely, yes, we do appreciate the support from the board.
Thank you.
Michael, go ahead.
Yeah, hi, this is Mike. I wanted to ask about the situation at New Joseph Bonham Elementary. SCUSD put out a statement last week saying that County Health initially recommended campus-wide closure there due to the 24 cases, but they wrote that the county County Health reversed its recommendation. So I wanted to ask if that's accurate. If so, what factors went into that reversal?
Yes, that is accurate. Usually when we are dealing with schools, when they report a cluster or an outbreak, there are a lot of steps that are involved. We have a schools team that works to get information about what is going on so that we have a clear picture to help us with making decisions. The initial information we got, it did appear that there might be some difficulty with the school being able to have enough staffing to keep the school open. So the initial recommendation for closure was based on that information. We did have subsequent discussions, including the school officials as well as the district officials, and continued to discuss what additional steps could be taken. And in the reassessment, realizing that they did have the capacity to do testing for the entire school, we made the decision that they should test the entire school first, and then we could base our decisions on that. The test that they did that first week on the Friday, there were no additional positives. So based on that, we required that they continue to do weekly testing, and we would monitor, but that they could keep the school open.
I do have a follow-up on that if there's no other questions in the queue.
Go ahead, Mike.
Yeah, has that, given that that particular school opened so early compared to a lot of schools in the district, I believe it opened more than a month ago, did this serve as a model in any way? Is this going to affect how case clusters or outbreaks are handled more generally? Depending on whether there's success with this wide testing system?
I think it definitely was encouraging to see that with being able to do the weekly testing that we were able to keep the school open. I think in terms of being able to use it widely, that is one of the tools that we have, the testing, in order to be able to make assessments. And we know that from CDPH, the goal as much as possible is for us to do whatever we can to keep the schools open so that the students can have in-person learning, because this time around they do not have the option of the online learning. So being able to keep the schools open does help. But definitely for each situation, it's different. So that's why it's important for us to have that communication and be able to make the decisions.
Just one final follow-up on that. Is there, capacity? I mean, are we okay in terms of supplies for the tests themselves for schools that I presume would be requiring a lot of them?
There are some restrictions in capacity, as well as the amount of testing kits that we have, especially with the Binax now. And we are working closely with the schools, but I think we did mention this last week that there is a national shortage of the antigen kits, which are advantageous to use in these situations because you can get the results back within a 20-minute period. So we continue to work on that, and probably that will determine how much testing we will do, but especially in situations where we're dealing with a cluster or an outbreak, we will definitely be able to use them in those situations.
Lena, go ahead.
Hey there. Dr. Kasirye, can you provide an update on our Sacramento County hospitals? Last week, we heard you talk about how they are at capacity or nearing capacity, and we're starting to have to transfer patients in between county hospitals. Can you give us an update on where we are at this week?
The picture is a little better in that now that we're seeing a lower number. In fact, it has dropped below 400 for hospitalizations and below 100 for the intensive care units. But some hospitals are still more impacted than others. They do coordinate and collaborate to make sure that they're able to take in patients that come in from the different areas in the county. So we're hopeful, especially now that we are seeing a decline in our numbers, that the decline that we're seeing in the hospitals will also continue.
And just one more question for you. Can you speak on the importance on getting your flu shot this year? Obviously, there's been so much pressure or so much hoopla around getting our COVID vaccines. Some of us may have forgotten we should get our flu vaccines. So can you speak on that and maybe why that is still very important this year?
Yes, we are entering the flu season, so very, very important to get the flu shots. Last year, we had a light season, and that's probably because of the measures we had in place where a lot of the places either had social distancing, masking, or were actually not in operation. This time around, a lot of places are open. So it's very important that we get that additional protection and get the flu shot.
Lisi? Apologies
Hi.
for butchering that.
That's okay. It's Lizzie with KCRA. I apologize. If you already addressed this, just let me know. I had to hop on late here, but just curious specifically about what we're seeing at schools right now in terms of COVID cases now that we're a few weeks or a month into the school year, depending on the district.
I'll start off and then I will allow Nick, who is on the schools team, to say a few more on what they're working on. But we are working very closely with all of the schools. We are seeing some cases, which is not surprising because we still have high transmission in the community, and most of the cases we are seeing are actually due to the community transmission. I will allow Nick to talk more about the work that the team is doing.
Yeah, I'll just echo that we have seen cases throughout schools in the community, and it's not unusual when a school first opens, especially for the school community to be a little bit shocked when they see that, when they hear that there are students at school that have COVID. But as Dr. Kassiria mentioned, that really is just a reflection of the high level of community transmission throughout the community. And it's not limited to just schools. We see that in workplaces and other places where you have a large number of people coming together. But thus far, the number of outbreaks have been relatively small and have been relatively self-contained. We discussed earlier the one larger outbreak that was addressed with some added testing. But generally speaking, it does appear that the mitigation measures, primarily mask wearing, appear to be effective in minimizing those effects. And then schools, of course, work closely with us to get guidance when they do have cases on campus in terms of how to implement quarantine recommendations, modified quarantine, which does allow students to continue attending class if they had an on-campus mask-on-mask exposure, if they meet certain requirements, primarily remaining asymptomatic, and twice weekly testing.
Last call for questions. Okay, with that, that concludes this week's public health media briefing. I will have the recording link emailed to all of you this afternoon, and we will put it on our website as well. Thank you for joining us.